Unggai-Bena in Eastern Highlands province has commissioned its first ambulance, a breakthrough in emergency healthcare for the district's 75,000 residents. The National St. John Ambulance Council, in partnership with the District Development Authority and the Provincial Health Authority, launched the service on the 15th of May 2026. This marks the first time the district has had direct access to pre-hospital emergency care.
I'm very happy that we have St. John's now who can do that. And we thank them for the culture they've created, a very high standard. And the turnaround time is on par with Australia, New South Wales state. It's not PNT time, it's on par with New South Wales turnaround time. So so we are very happy with that. And to my people, I want to say this: it's not cheap to build hospitals everywhere, big hospitals, and we don't have enough doctors. We have a huge shortage of doctors and nurses. The demand is huge, but the number of doctors and nurses that we have is not enough to cater for everyone. And it's very expensive to even operate a hospital. So at least we have one main one in Goroka, one in Kainantu, and we're now covering the entire province. And for us, Unggai-Bena, we are closer to Goroka, and that's the whole reason why we've been partnering in a big way, supporting Goroka-based hospital through the PHA. And again, so we're trying to fix roads, but have a reliable ambulance service. So ambulance can go pick him, you want to have your sick, pick, and then take you straight to the hospital. As long as there's road access, then we can come back and put aid posts and clinics and so forth. But the important thing is we already have a good hospital, doctors, not far, just right here in Goroka town. There's a big something, people are fixing road, blah, blah, blah. An ambulance is here, picks you up, take you to the hospital, you get treated. So
recruitment began in 2025 with 4 local officers completing formal ambulance training. They now join 4 experienced officers from Port Moresby, making up a team of 8. Since February, the team has responded to more than 200 emergencies, supported community events, and ran awareness programs, teaching residents how to access ambulance services.
We are about to start recruitment for the second ambulance, so the Minister's vision around getting pre-hospital care to all people in the district is definitely coming to light. So we're also now recruiting for an additional 11 ambulance officers that we'd like to recruit from the local area as well. It's been, like I said, a long time coming, and we thank yourself, Minister, and the PHA and the District Authority for their support in getting this off the ground. I look forward to getting out and seeing more of your patients at facilities and working together closely in the future.
The service operates 24 hours a day, 7 days a week. Plans are already underway to recruit staff for a second ambulance, which will expand coverage and create new jobs for local men and women.
A service that will benefit our people. We want to also thank St. George for choosing Eastern Highlands too, and then coming. This will really help us because bulk of our people are living outside of town and only few in town. We have problem with bringing people in when they are if they face any kind of emergency situation. We have people being transported on vehicles that are not helping them to reach the hospital. So we understand that pre-hospital care is very important. So having trained people escorting or bringing in casualties or bringing in emergency cases really help our doctors in the hospital to take on from what they have initiated at the point of injury, accident to the hospital. So it's a big bonus for us. It's a big something that will really help us to save lives. So I really want to say thank you on behalf of Goroka Provincial Hospital. That will make our work easier, to our Honorable Minister for bringing the service to the province and into his districts, and it will help Eastern Highlands people living around the catchment area. So we hope that from this point we can extend it to the districts as well, other districts.
For Unggai-Bena, this project is more than just an ambulance. It is a lifeline, and the start of stronger, faster emergency response across the district.